Hi, good morning everyone. Today we will discuss about the topic enema and the types of enema. Okay, so enema is a procedure in which water or a soap solution or whatever solution according to the types solution will introduce into our intestine or a lower intestine to evacuate the content, excess content from the intestine, or otherwise to introduce some medication or other nourishment purpose. We can use this enema. So we can go to the enema definition. So enema is an introduction of fluid into the lower bowel through the rectum for the purpose of cleaning or to introduce some medication or a nourishment. So that is called enema. So purposes. What is the purposes of enema? So to stimulate defecation and to treat constipation. That is a major purpose that we are commonly see in our hospital situation, like to stimulate our defecation or as a treatment part of constipation, and to soften the hard fecal matter. If some patient is having some constipation or fecal impaction problems, that time we can use as a treatment protocol enema. Then what type of enema and all we can see later. So to administer some medications, so like suppositories, we can use like suppositories. It is only a medication. So like that, large amount of medication we can administer through enema procedure to protect and soothe the mucous membrane of intestine and to check the diarrhea. At the time of diarrhea, if the patient is having a chronic diarrhea, that time the mucous membrane will be irritated. That time as a management also we can use. And to destroy the intestinal parasite, to relieve the gaseous distension, to administer the fluid and nutrients to relieve the inflammation, to administer fluid and nutrition to relieve the inflammation, to induce the peristaltic movements, and other purposes include to stimulate a person in shock and collapse, to reduce the temperature, body temperature we can reduce, and to clean the bowel prior to X-ray studies, visualization of the bowel, surgery on the bowel, or delivery of a baby. These all purposes also we can use the enema as a diagnostic and management purpose, and to make the diagnosis, to establish a regular bowel function during the bowel training program. Because if the patient is having any problem or constipation, fecal impaction, that time we will start with a bowel training program. That time also we can use enema as a management part, and to induce the anesthesia. So these are the major purposes of enema. So next, we can go to the classification of enema. So, enema broadly it is classified into evacuant enema and retained enema. Evacuant means like a cleaning purpose. We can evacuate or we can clean the bowel contents out. Next is a retained enema. It will retain for some time to absorb that material into our body to a management for a management purpose or as a diagnostic purpose. So evacuant enema, again, it is divided into simple evacuant enema, medicated evacuant enema, and cold enema. This is the three subclassification of evacuant enema. Next is retained enema. It is again divided into stimulant enema, nutrient enema, emollient enema, sedative enema, and anesthetic enema. So from the word itself, some enema type, we will get little idea. So next is evacuant enema. We can go to what is evacuant enema and what are the subclassifications. So from the evacuant enema, first is simple evacuant enema. So simple evacuant enema to stimulate the defecation to treat the constipation. That is the major purpose. And to relieve the gaseous distension by stimulating the peristaltic movement, to relieve the retention of urine by relaxed stimulation of the bladder, to stimulate uterine contraction to hasten the childbirth. So how to stimulate uterine contraction? By relieving the bowel content out. And to cleanse the bowel prior to X-ray studies, visualization of the bowel like a sigmoidoscopy, surgery, and retention enemas. This is the major purposes of simple evacuant enema. So it is very common, simple evacuant enema. So solutions, what are the major solutions we can use for the simple evacuant enema? It includes soap and water. It includes soap jelly 50 ml to 1 liter of water, and normal saline sodium chloride 1 teaspoon of half liter of water, or a tap water. Any one of solution we can use as a simple evacuant enema. Then amount of solution will be used. For adults it is around 1 liter we can use, and children's around half liter, and infants about 250 ml of a solution, or less than that we can introduce to the bowel. Then temperature should maintain like 105 to 110 degree Fahrenheit, or in children's around 100 degree Fahrenheit we can maintain the temperature of the solutions. So these are about the simple evacuant enema. Next is oil enema. So these are given to soften the fecal material in case of severe constipation. So in case of severe constipation or fecal impaction, that time the simple evacuant enema is not properly removing the bowel contents. That time we can go for oil enema. So before the first bowel movement, after operation of the rectum or perineum, or to avoid straining and injury to the sutures and wounds, and it should be retained for half to 1 hour to soften the faces. That's why oily appearance or oil nature we will introduce. That time we will wait for half an hour to 1 hour to make that stool or hardened stool to soften. And it should then be followed by soap and water or simple evacuant enema that already we discussed. So that is the steps. Next, what are the solutions we can use to, like olive oil, gingerly oil or sweet oil, castor oil, olive oil. These are all common oils we can use. An amount around 115 to 175 is less amount than the simple evacuant enema. Then temperature also 100 degree Fahrenheit only we will use. So next is a purgative enema. So these are given to the bowel to contrast actively and to evacuate its content. That is about purgative enema. So it acts as by their irritating effect on the mucous lining and stimulate the peristaltic and cause the evacuation of the bowel. That is about the purgative enema. So the stretching of the intestine due to this inflow of fluid causes the intestine to contract and lead to an evacuation of the bowel. That is the major mechanism of this purgative enema. So the solutions used include pure glycerin around 15 to 30 ml, glycerin and water in 1:2 ratio, glycerin and castor oil means 1:1 ratio, or a magnesium sulfide 60 to 120 ml with a sufficient amount of water to dissolve that magnesium sulfate, like 1:3 enema, like magnesium sulfate 30 ml, glycerin 60, water 90. That is 1:3 ratio enema. Amount and temperature is same as that of the oil enema. So oil enema also it is around 100 degree Fahrenheit and the amount is 175 ml. So like that solution volume and temperature we can maintain. So next is anhelmintic enema. So that word itself you will get to destroy the worm infestations. So this is given to destroy and expel the worms from the intestine. So before the treatment is given to the bowel, should be cleansed by soap and water. Then only it will absorb or it will react in our bowel. So that the drug may come in direct contact with the worms in the lining of the intestine. So worms will be attached into the lining of the mucosal intestinal mucosa. So if it is impacted with the fecal material, means it will not absorb properly. That's why before starting the anhelmintic enema, we should clean with, or we should apply the simple evacuant enema to clean the bowel, then start with the medication. So treatment is until the worm is destroyed, and solution usually hypertonic saline solution in sodium chloride 60 ml with 600 ml of water. That is the proportion we can make as a hypertonic saline solutions. Next is carminative enema or antispasmodic type enema. So here also word itself we will get to reduce the gaseous distension of the abdomen by causing peristaltic and expulsion of the flatus and feces out. So it is given as a simple evacuant enema. Here we can use turpentine as common material and 8 to 16 ml of turpentine mixed thoroughly with 600 to 1200 ml of soap solution. And milk and granular sugar, it's a type of sugar also we can use, like with 90 to 230 ml of granular sugar mixed with equal quantity of warm milk. So that is the common for carminative enema. Here we are commonly using turpentine. Next is astringent enema. So here it contracts the tissue and the blood vessels, check the bleeding, inflammation, lessen the amount of mucus discharge and give a temporary relief in the inflamed area. That is the major purpose of this astringent enema. It is usually given in cholera. It is the dysentery, continuous dysentery patients and all, there will be inflamed mucosal lining. So that all time we can use this astringent enema as a therapeutic purpose. So they are usually given in the form of rectal or colonic irrigation. So the solution is allowed to run slowly, return quickly to avoid distension, pain, irritation of the inflamed bowel wall. So that is the major purpose of astringent enema. Next is last one is cold enema. So here this is given to decrease the body temperature in hyperpyrexia and heat stroke. It is given in the form of colonic irrigation. It is also to, for if the patient have a hypothermia, we can reduce the temperature by this cold enema. And complications, hypothermia and abdominal cramps. So that is about the astringent. We already discussed. In the astringent enema solutions we will discuss include tannic acid, alum, silver nitrate, and temperature should maintain according to the patient tolerance level. So how much patient can tolerate, that much we can introduce for astringent enema. Okay, so next we can go for the retained enema. So what is the retained enema? It is again divided into stimulant enema. First is stimulant enema. Stimulant enema is given in the treatment of a shock and collapse. So stimulant enema is the is used as a purpose or in as a management of shock and collapse. It is also sometimes given in case of poison, like opioid poisoning also we can use. So solutions include black coffee. Here we are commonly using coffee, and one tablespoon of coffee powder with 300 ml of water. It is a stimulant. That's why the name stimulant enema. Amount around 1 to 50 ml. We can use temperature 108 to 110 Fahrenheit. We can use. So that is about the stimulant enema. Next is sedative enema. So sedative enema include retention enema contain a sedative drug to induce the sleep. So sedation purpose we are using. So drugs are paraldehyde, chloral hydrate or potassium bromide. These are the common sedative enema solutions. Next, emollient enema. So what is emollient enema? This is an introduction of a bland solution into the rectum for the purpose of checking diarrhea or soothing and relieving irritation on an inflamed mucous membrane. So this is when the mucus inflammation is there, that time we can give for this emollient, give the emollient enema. Solution, starch and opium, and amount around 120 to 180 ml, and temperature should maintain between 100 to 105 Fahrenheit. So this is all about the emollient enema. Next is anesthetic enema. Last one, it is a retention enema containing an anesthetic drug to produce like a sedative only. So here it is anesthetic materials will use, like avertin we can use as a anesthetic enema, and 150 to 300 mg per kg of body weight we can introduce the drug. So that this all about the anesthetic and sedative emollient. Next about the nutrient enema. So in the nutrient enema, it is a retention enema to supply the food and fluids into the body. So if the patient can't take by orally or parenterally, that time we can administer through rectally or through our lower bowel. So selection of the fluids depend upon the ability of the colon to absorb. A nutrient enema is particularly useful in condition like hemophilia, which makes IV infusion difficult or undesirable. Usually, if the patient is NPO, if the patient can't take on by orally, that time we will start with a parenteral solution, so parenteral administration of fluids or nutrients. But in case like in hemophilia conditions and all, both is difficult. That time we can start with the nutrient enema. So here also they will absorb the nutrient contents. So this all about the nutrient enema. So next is what are the solutions we can use by this nutrient enema include normal saline, glucose 2 to 5%, amount of solution around 1.7 liter in 24 hours, or 180 to 270 ml at 4 hourly. At an interval dose we can use. Temperature should maintain at 100 Fahrenheit. Okay. So this is about the nutrient enema. So far we discussed about the all types of enema and subclassification. So it is once again I will tell Enema again divided into evacuant and retained enema. Evacuant enema again divided into simple evacuant, medicated, and cold enema. So retained enema is divided into stimulant, nutrient, emollient, sedative, and anesthetic enema. So this evacuant enema also simple evacuant, and oil enema is there in the medicated. Again, it is divided into oil enema, then purgative enema, anthelmintic enema, carminative enema, astringent enema, and finally cold enema. So these are the major classification of enema. So these all enema, each and every enema type have its own importance. So according to the patient need and situation, we will select what type of enema is suitable for that type of patient, and we can use. If the patient is having a long-term constipation or fecal impaction, we will go for a evacuant enema. If the patient need any emergency situation, like the patient need anesthetic or some other route is not proper, we can't use that routes. That time and all we can go for retained enema, or some medication purpose we can go for medication enema, or a nutrient or some nutrition we can give. That time we can go for nutrient enema. Or sometimes the patient is going for the shock or collapse situation. That time also we can go for the that type of enema. So according to the need of the patient, we can use that. If the patient is going for hypothermia, we can use the cold enema. Okay, so I think you got little idea about what is enema and what are the major types of enema, and it's a procedure, and what are the articles we can use for this enema. We can discuss in the next section. Okay, thank you.